My name is Anna Fadic, and I'm with Men's Health Network, and we have just finished with our prostate cancer briefing today, focusing on prostate cancer screening and the U.S. Preventative Services Task Force recommendations and the challenges that they are currently facing. We are here with Dr. Knapp, who is a speaker today, one of the panelists, and we're going to be talking about diagnosis accuracy and why it's so important. So, Dr. Knapp, why is diagnosis accuracy so important?
Well, Anna, we just heard all the presentations regarding the importance of diagnosing cancer early and the use of the PSA testing to do that. It's also equally important, maybe even more important, that when you do diagnose it, that you're certain you're diagnosing it accurately. And there's a test that can be done, DSPA testing, that's using DNA comparisons in order to match a reference sample with the biopsy specimen to ensure the diagnostic accuracy with the patient before the patient goes on to potentially toxic or invasive treatments. The error rate of doing that is a little over 1%, where we'll have patients that actually get a diagnosis of prostate cancer that has been a misdiagnosis in their case, and we certainly don't want those patients to go on to any type of invasive therapy under those circumstances.
Great. And is your test available in all physicians' offices?
It is. The test is actually performed in many laboratories across the country. It's performed at some major medical centers in their laboratories. What we did in our laboratory was to automate it so that it could be done very routinely with patients. We developed a specialty kit and collection mechanism so that the reference sample could be collected at the same time as the biopsy. Then it's sent to the DNA laboratory and stored at the DNA laboratory, waiting for the tissue specimen biopsy to come back with the presumptive diagnosis of cancer. If it does, it's matched with that reference sample before the physician speaks with the patient about the diagnosis and treatment. So they are actually DNA certain that the diagnosis is correct before they go on down the treatment path.
Well, I hope that all patients know about this opportunity. I think it would be, very beneficial in access and patients to have that option.
We are working hard to get the word out. We are in over 250 laboratories across the country currently. We're in 12 of the 15 largest urology practices in the country use us as the standard of care. And we do think it is the standard of care. It just needs to get in everybody's hands, and we need the help of the legislature to help us do that.
Great. Well, thank you so much, Dr. Knapp. Really appreciate it.
Thank you, Anna.